Yeah, yes. Good afternoon, everyone. It is great to be with you. We have a great presentation for you this afternoon. Um, this is a webinar series that is presented by the Emory Cognitive Neurology Department in conjunction with the Emory Integrated Memory Care. And I am Jenny Gay. I'm a clinical social worker for the Integrated Memory Care. I am joined by my colleague, Laura Metters, who is also a clinical social worker and our program director. I'm joined by my colleagues, Alice Cooper, one of the cognitive neurology social workers, given that great wave right there. And we've also got Ashley Barner, lead cognitive neurology social worker with us here. And last but not least, we have our wonderful speaker, who is Danielle Powell-Godfrey, who is going to be giving us an awesome presentation today. And you can see up on the slides the title of the presentation. And if you'll give me just a second, I want to read a little bit about Danielle. Danielle Pyle is an occupational therapist with a strong foundation in acute care and community-based organization, striving to provide person-focused and evidence-based interventions. Danielle works as an occupational therapist in Integrated Memory Care's community program at various assisted living and memory care communities throughout Atlanta. And we are so lucky to have her with us. Please note that while we go through the presentation today, go ahead and put your questions in the chat feature on your Zoom, and we will answer those questions at the end. And I forgot to mention in the introduction that this presentation and this series takes place on the second Wednesdays of each month from 12 to 1, and we will have another presentation next month as well. So without further ado, I'm going to let Danielle take it away. And
just one second, just housekeeping detail. It's in the Q&A box. Put your questions in the Q&A box.
Thank you so much, Alice. You're welcome. Q&A box. That's the place. Okay, thanks, guys. Danielle, take it away.
Good afternoon, everyone. Thanks for coming today. I also have Amber Stewart with me here. She's one of our dementia care assistants in the community program, and she's going to help me do some practical demonstrations for techniques that you can help people with dementia move around with and use different devices for activities of daily living. So, like I said, we're going to have a little demonstration. Our planned demonstrations for today are to show some techniques to help with sitting to and from standing, transferring from one surface to another surface, walking, walking up and down stairs, how to assist someone with using a walker, putting on and taking off a jacket, and then feeding. If there are any other things that you would like to see us within reason, we will do our best to accommodate it. And you can just throw them, I think, also in the Q&A area. So the first thing that I wanted to do was give a brief definition of what activities of daily living are. They are activities that involve caring for one's body. They can also be more complex and occur outside of the home and in the community to support our daily needs. Today, we'll primarily be focusing on basic ADLs, which, like I said, involve caring for your body. So things like grooming, dressing, bathing, feeding, as well as mobility. And I think the best general way to describe mobility is the way that we move through our environment, whether that's independently, with assistance, using an assistive device or not. Independent ADLs, which are the more complex activities of daily living, include things like cleaning our house, driving, managing finances, and going like grocery shopping. So in order to, I think I skipped a slide, sorry. There we go. So what is the impact of dementia on activities of daily living and mobility? So we know that dementia can change the way our brain is able to communicate with our body. I find that the connection between the brain and the muscles are slowed. So it oftentimes can take someone with dementia extra time to produce a movement. Dementia can also limit our cognitive reserve. and impact skills like attention, organization, and processing. When we see people who have had changes to their ability to attend or not be distracted from a task or an activity, we notice that they might do something like stop in a really busy lobby, just kind of right in the middle, and look around and be just very distracted by the visual cues surrounding them. You also might notice that they're less responsive to you calling their name. Organization or changes with organization, I think, are most noticeable when we look at our self-care activities. So you'll often see someone do something like maybe put on lipstick before brushing their teeth, and then not then reapplying that lipstick. And then finally, processing. It takes someone longer to process a verbal or even visual cue that you're giving them. So let's say that you want to hand that person a fork to eat their meal. They may require extra time to initiate that movement and acknowledge the cue of you handing them a fork. Dementia can also impact our vision, depth perception, and hand-eye coordination. I feel like the most common thing that cues me into some vision changes is if someone has like a cup or something that they're reaching for on the table, and they'll either overshoot, so reach way past that cup, or in the wrong direction for that cup, or undershoot. We know that dementia can impact our memory, and this includes our psychomotor memory. So for movements that we do throughout the day, we really rely on psychomotor memory, even for things like walking down the hallway. So when we see changes to our psychomotor memory or our muscle memory, it makes it increasingly difficult to produce even sometimes simpler movements. Then finally, we know that some types of dementia can contribute to acute changes or injuries that will impact how well we are able to move our bodies. So for instance, vascular dementia can, make us more likely to have a stroke, which can result in weakness, which then impacts our ADLs and mobility. So when I try to support folks with maintaining their independence with activities of daily living and mobility, I like to use and think it's important to use a multimodal approach. The first thing that I always try to look at is the person's environment and how it's supporting or hindering their independence. So a couple of examples would be rugs. A lot of times it's recommended that we don't have any throw rugs around in the environment, but some people are very attached to their rugs, which is fair. So we can do things like secure the rugs with rug tape. I also like to make sure that there are clear paths in the living environment to support someone moving safely through the living environment. And this doesn't necessarily mean just like huge wide open spaces, because some people may rely on furniture walking to move around their home. And if that's what they do, we want to make sure that while we have nice clear paths, we also have well thought out furniture placement. So if that person is using it to lean on while walking or moving around, or if they need frequent rest breaks while moving around the house, they have that, and we can help prevent falls. When we look at something like modifying the environment for someone that maybe has some difficulty with their attention, we want to find ways to decrease the noise level. So it could be something as simple as wearing headphones or listening to music, but that could be distracting for your loved one as well. So maybe some noise canceling headphones, or making sure that when we're walking into an environment, we're prepared and we kind of know what we're going to see. Another kind of straightforward tip is to guide your person while you are walking with them if they are easily distracted. So something that the dementia care assistants and I try to do is, as long as it's acceptable to that person, hold their hand, walk slightly in front of them so that they have the visual cue of you walking in front of them. And then they also have the tactile cue of you kind of moving them forward. Lastly, for someone who is having some difficulties with attention, it's really important to get eye contact with that person, because that, like when we're talking to anyone else, gives us that cue that we know that they are more likely paying attention to us and able to follow through with what we're talking about. We can also add signs and pictures to the environment. This is one that's really helpful for organizing tasks like brushing teeth, washing faces, and showering. And then I kind of touched on this before, but thinking about how we can change how we are communicating with that person to make it more effective for them. So rather than just saying something, giving a visual cue, like, you know, hey, your daughter is on the phone. Or giving a tactile cue, like if you would like someone to stand up from a chair, maybe touching them on the back to see if that little lean forward will help them initiate that movement. We also want to provide assistive devices as possible to support function. So this is a tricky one, because sometimes when we add an assistive device further along in the disease process, it can be more of a hindrance than a support. But if there is a way for us to make something easier for someone to do through an assistive device, it's important to try to introduce it. Again, being aware of how your approach to assistance may be hindering or supporting the person. Something that I really like to talk about often with people is when you give someone a cue, especially a verbal cue, but even a tactile or visual cue, give that person the time to process what you're saying and produce whatever end result we're looking for. I think sometimes it is tempting to, once you don't see someone doing something, give that cue over and over and over again, but that can be frustrating for that person, and it can also kind of be detrimental to your end goal. It's also really important that you know that trial and error is often the best way to support your loved one. We know that with dementia, something or a technique that worked, you know, the day before or the week before may not work moving forward. And so we often have to update what we're doing and better fit it to that person so that it is the optimal setting for this person to engage in ADLs and mobilities. And then lastly, I think it's really important to identify opportunities to maximize your person's independence and function. So, you know, I know that at times there can be a time constraint, and so we just help the person do whatever it is that needs to be done, but finding even small opportunities for a person living with dementia to have purpose, independence can improve quality of life. So now I have some typical ADL equipment, and I'll kind of talk through what they are and how they can be used. So the first one is this 3-in-1 bedside commode. In this picture, it's being used over a toilet, which is one of my favorite ways to use it. I think it's a really sturdy piece of equipment. It also comes with a bucket under the seat, and so it can be used at the bedside as a bedside commode. When used that way, it can be helpful for people who have to urinate or have bowel movements frequently during the night when they're unsupervised. It can also be used as a shower chair. You would just remove the bucket like you would if you were putting it over the toilet, and it can also just be used as a seat in the bathroom. So for someone that maybe has lower endurance, it's helpful to kind of place this in front of the sink and allow them to have a seat. Next to it, we have a shower chair. This is a pretty versatile piece of equipment as well. It can be used in the shower, can be used in the tub, but I think primarily shower. It can also just be used as a seat in the bathroom as well. I'm going to come down here next. This is a toilet seat riser. serves a similar purpose as the 3-in-1 bedside commode when placed over the toilet. It elevates the toilet seat height, so it takes less energy to sit and stand. For folks with maybe arthritis in the knees or hips, it can be a much more comfortable seated height. Honestly, if you want to elevate your toilet seat height, I do recommend the 3-in-1 bedside commode over a toilet seat riser because I think it offers more stability. Next to this, we have the tub transfer bench, which if you have a tub is a really great option. It allows you to help your person get undressed and dried off while seated the entire time on the tub transfer bench, rather than having to deal with a transfer when it's wet or slippery or cold. And then the last, or this isn't the last thing, but down here we have a built-up foam handle. These are also super versatile. You can put them on eating utensils, writing utensils, shavers, all kinds of stuff to decrease the amount of grip strength and range of motion in your hand and digits to be able to hold something securely. So typically our silverware handles are very slim and small, so you have to kind of hold pretty tightly and have really full range of motion in your hand. With these, we can have range of motion closer to here, so it makes it easier to handle. I also think that it can give someone a nice bright visual cue of like, hey, pick up the red fork on your left. And then the bigger size gives us more tactile input. So you kind of have like a couple of added benefits as well. And then this one up here in the top right is my favorite piece of assistive equipment. I think whoever created it is a genius. It's called a sock aid. It's two ropes attached to a half cylinder. You can see they have the sock over the half cylinder, and it's just an easy way for people with difficulty leaning forward or reaching their feet or bringing them to like their trunk to put socks on and off. These last two examples that I gave, I think, are really good examples of how we can allow our loved ones to have smaller opportunities for independence. So this one is a little overwhelming, but I'll go through it a little bit faster. I'm going to start with our wheelchairs. You have your standard wheelchair, which allows you to push your loved one or for them to move themselves through space with feet or arms, a power wheelchair, and a transport wheelchair. Transport wheelchair is just going to be where you are pushing your loved one. The power wheelchair, something to think about, is it takes up a lot more space in your home. You need wider pathways to be able to use it. And then your loved one will also need to be able to operate the joystick or whatever is driving the wheelchair around. I think the piece of equipment that we're all most familiar with is our rollator, our rolling walker, and our standard walker. They kind of move from so our rollator is a great alternative because it has a seat on it and it's very easy to turn and move around. Something to think about with a rollator is that you need to have pretty good balance to control and safely move through a space with a rollator. Whereas the middle walker, the two-wheeled walker, gives us a little bit extra stability from a balance perspective. And for someone who you are noticing balance changes with, it can be a good alternative because of the similarities in how they are manipulated. And then lastly, we have a standard walker with no wheels, which is not typically that we see some used with the population of people living with dementia. It's just not really practical and does require a higher level of balance. Moving up here, we have a single point cane and a quad cane. They serve the same purpose. They're good for folks who are maybe having one-sided hip or knee pain. The quad cane here gives us a little bit extra support and requires a little bit less balance. Here's our hemi walker, which is good for individuals who are having leg and arm weakness on one side and gives really nice stability. then our crutches. We also have a sit to stand device. This does require that your loved one be able to stand so that these two smaller plates can be placed under their buttocks. And then we have a Hoyer lift, which allows us to dependently transfer a loved one from one surface to another surface. To keep in mind though, you know, a Hoyer lift can be dangerous if not used correctly, and can also be pretty frightening to just be like flying through the air. So again, using things like tactile visual cues, soothing exercises before using it with your loved one who may be nervous about it. So now we're going to do our demonstrations. Before we get into that, does anyone have any questions? All right, cool.
Yeah, I don't see any questions in the Q&A yet, Danielle, but folks, feel free to put in your questions as we go along into the Q&A section. I know several people have joined us since we got started, and we will definitely have time at the end for Danielle to answer questions.
Perfect. Thank you, Ashley. Okay, so I'm going to flip my laptop around so you can see our little make do space here where Amber and I are going to do some demonstrations.
Danielle,
Yes.
you probably want to go ahead and cancel out your slideshow so that folks can see you in full screen. There you go.
Okay. Amber, if you want to have a seat there, that'd be great.
And for those who are watching, you can change your view to just seeing the speaker view, and that will give you a bigger screen to see the demonstration.
All right. Sounds good. So like I said, we're going to start with sitting or sitting to standing or standing to sitting. So we're going to say that Amber is maybe having some difficulties initiating the movement to stand. So the easiest and least invasive technique would just kind of reach behind Amber and give her this cue to stand. Because when you think about it, when we're standing, the first thing that we do is bring our nose over our toes. When we want her to sit, we can also give her a cue kind of at her hip so that she bends, and then that kind of helps initiate the movement. The next thing that we can do is, this is a gait belt. It goes around the person's waist. You can also use a regular belt. And these can be ordered off of like Amazon or found sometimes in like pharmacies or Walmart, and they're relatively inexpensive. If you don't have one and you want to use one, I would recommend just using a belt, a nice sturdy leather belt. So the next thing that we can do, and you always want to make sure that you are protecting your back, especially if you're going to give someone a lot of or a good amount of support to stand up. Place hands on either side of their waist here, help them lean forward and up into standing. So you're still trying to get that same pattern of leaning forward and then kind of straightening everything up to stand up. And then same thing, if Amber's going to sit back down, I can give her a cue, but I can also give her support in the front of the belt to prevent her from plopping down into the chair. Another technique that we use a lot here for people that maybe don't respond as well to the subtle cue of like the hand on the back, or will lean back because they're scared when you're trying to just kind of like give them some good oomph to stand up, is holding them by the hands. And when we use this technique, we want to be careful because we don't ever want to like pull someone up where they're leaning back and we're kind of like really putting a lot of stress on their shoulders. But if I start doing this and Amber starts to lean forward with me, I can easily put one hand back on the chair and then have her stand up. Now, please sit back down and then do it like the wrong way. If I start trying to do this and I notice that Amber's just hanging out like this and I'm putting a lot of strain on her shoulders, that's not a helpful technique to use. And we got to think through a different way to do it. Okay, so I'm going to bring another chair over. Will you move your chair? Yes, please. Thank you. I'll do it like that, and that should work. Oh, you can do it. Okay, so same thing, when we're moving from one chair to another, so I feel like this would be most common when we are standing from a chair and sitting on to a wheelchair, or standing from a wheelchair, or I don't know, a toilet seat to the tub transfer bench in the bathroom. When we're setting up a transfer and we know that someone has a hard time staying in standing or doesn't tolerate it well, the best angle to set your chairs or surfaces up with each other is a 45-degree angle between the two surfaces. So you want it to kind of be like that. That gives us the least amount of space for their bottom to fall through if they were to like have their knees give out or anything like that. So same technique, I'm going to hold Amber by the gait belt or give her that cue to come stand up. We're going to make sure she's fully standing. We're going to make sure that she's paying attention to what we are wanting her to do. And then we'll give her a cue to take some side steps into the chair. Then we'll give her a cue to hopefully reach back for the chair. And then we'll give her some resistance to sit down slowly. The technique is pretty much the same, where you wouldn't be holding onto the gait belt if your person didn't need that, but you would be giving cues, maybe a tap on the leg, a tap at the arm to reach back for the chair throughout if needed. Okay, so move the chairs around again. Yeah, no, you can push that back. We'll show them walking. Yeah, we'll push back. Okay. So like we were talking about before, I'm going to have Amber come stand up with me. And we're walking through a busy hallway. So what I like to do is take that person by the hand, be slightly in front, make eye contact with that person, and kind of clear a path for them. Like I said, you're giving that person a tactile cue because you're very gently guiding them forward if needed. You're also giving them a visual cue of someone that they know, walking in front of them and kind of guiding them through. If you are concerned about balance at all, another good way is to have your hand under their hand. And if you need to hold on to a shirt, belt, gait belt at all, you can also give this cue at the back and then kind of use your hand in front to guide them as well. Next one is going up and down stairs. So unfortunately, we don't have stairs in this small room, but I will show you how I would position myself and different things that I would use to help someone kind of move up and down the stairs. So if we are going downstairs, if you have a gait belt, again, just holding here. If you don't have one, kind of holding here, or if the person doesn't need you to hold on to them, you can give them, I'm gonna see if I can let you guys see Amber's legs a little better. Okay, you can give them a cue, a tap on the leg if you want them to, like for whichever leg you want them to step down with. For me, when I'm helping someone walk down the stairs, I like to be in front of them or on a step below them to the side. You do have to think about though, if that person does fall, they will fall onto you. So if you feel more confident being behind that person, then you should do that. And it would be a similar technique where you would be close to them, holding the gait belt, and then giving tactile cues if you want. So with Amber, I would kind of tap this leg and have her step down, and this leg and have her step down. When you're helping someone, you also want to have a nice, strong, wider base of support, but you don't want it to be too wide as well. Walking up the stairs, you want to be in front of the person, again, holding on to the gait belt, and then being able to give tactile cues to step up. When you're walking up the stairs, it can also be helpful to kind of tap behind that person's knee to initiate that knee bend and like hiking the hip to move up the stairs. So the next one is assisting someone with a walker. I'm gonna bring my walker in. I'm gonna move this chair out of the way a little bit so you can stand back further. Okay. So when helping someone with a walker, I feel like it's really tempting to like get all up in their grill and like try to push the walker for them. That can be confusing for the person. And if you're having to do that for someone who's using a walker, then potentially using a walker may not be the best fit for them. You can simply have a hand on their back and then have kind of a hand here in case any assistance is needed. For someone who tends to push in one direction over another direction, like let's say Amber's right arm is stronger than her left arm, and so she tends to push her walker like this. I like to stand on the side that has more weakness so that I can counter her pressure on the right or stronger side for her. That kind of supports independence. It's generally not helpful if you stand in front of the person. You're kind of blocking their view. You're not really giving them the opportunity to navigate on their own, which kind of fits in well with finding opportunities for independence for your loved one wherever you can. Can you think of anything else we should say about walking on the walker?
Making sure that it's not like.
Yeah. You got it. So when you're walking with a walker, we always say it's like a little box. So you want your feet to be in that box. You don't want your butt sticking out. You also don't want to be right up against this front part. The reason being you don't get the benefit if you do kind of lose your balance or as much of a benefit in those positions. So, do you have your jacket with you? No, that's okay. That's okay. We don't have a jacket with us, but I'm just gonna mime it. Sorry. That's okay, me too.
Okay.
Silly. Okay, so when I'm helping someone put on like a jacket or a shirt, I also think it's helpful for people that maybe have a lot of difficulties with dressing to wear button-up shirts or zip-up shirts, just because it takes less time, it's a little bit easier. But when I'm helping someone put on a shirt or a jacket, I put my hand through the bottom part of the sleeve, so the wrong way. And then I take my hand out, I take their hand, and I translate the sleeve that's on my arm the wrong way up to about mid-arm here. And then put this arm down, come over here. I still have the jacket in my hand. And again, I'll put my hand up the sleeve the wrong way, reach for their hand, pull it through, and then pull up and over their shoulders. So I know that was a little silly without a jacket, but I hope that you get the picture. And then the last thing that we'll do is feeding. You can sit back down for this one. Yeah, you move that up.
There you go. Oh, yeah.
Okay. We're gonna pretend, sorry everyone, terrible noise, that this is a fork. And so let's say that I'm handing Amber this fork. She's not really acknowledging me. She's kind of distracted. I'm gonna give her the tactile cue of, hey, and then offer her the fork. It may still take her a minute, but she'll ultimately likely grab the fork from me. When we're feeding, there's a couple of techniques that can be used to help your loved one. A good one is kind of providing support under their elbow, so they're not having to maintain that lifted position of their arm, and really they're just focusing on this like bending their elbow and straightening their elbow. If you find that that's still difficult, you can do a light touch under the wrist. if they're having some difficulty holding the fork and they don't have a built-up handle or that doesn't work for them, you can do hand over hand. So you're basically holding their fingers in position to grip that fork or spoon and bringing it up. And then, of course, I think even if you are like scooping the food, giving it to that person, it's still helpful as long as it makes sense for you to allow your loved one to hold the utensil in their hand, because it kind of triggers our brain and it will help with stuff like opening their mouth, closing their mouth around the spoon, all that kind of stuff. So that is all that we had for demonstrations. It doesn't look like there's any questions.
So a lot of times the questions come when you finish up. So y'all, if you have questions, I know we've had a lot of different folks join. So if you have specific questions for Amber and Danielle, please put them in the Q&A section down below. Danielle, that was amazing. I think it's the first time that we've actually had demonstrations. So thank you, Amber, for coming to be part of that. And I learned a ton.
Thank you. Thank you for that.
I'm so sorry I didn't have an opportunity to introduce Amber at the start of the presentation as well. Amber Stewart is one of our dementia care assistants in our community program, and she is wonderful. And she is the original dementia care assistant.
Yeah.
Thanks, Jenny.
Any questions today?
I often get questions about if my
Laura, you're going to need to get closer to the mic.
I often have questions from families that say, my person now needs a walker, my person now needs a wheelchair, but they are at some point in their dementia diagnosis where it has become difficult for them to remember that they need or could benefit from these assistive devices. So do you have suggestions for integrating that into a person who is not used to using one of those assistive device tools, whatever the
Yeah.
assistive may be?
Yeah, I think that, again, looking at like, do you have stuff set up in the environment so that person knows that that piece of equipment is there for them and it's going to be there to help with their safety? I think that while I have found that a lot of our residents will be even resistant to using the piece of equipment, but if we can incorporate it in ways that are a little bit more joyful, sometimes it's more acceptable. So like saying like, hey, I know that you love to play golf and I know that you wanted to do putt-putt, but I think that the cane's just going to get in your way. So let's just bring this walker. We don't have to use it. I think we really try to do like a no pressure approach because while a lot of times something like that will be beneficial, if we like bring negative experiences to it or force someone to use it, I don't think that it's very helpful. I do think too, though, that while it's important to maintain mobility, so that ability to walk and move and sit and stand and transfer, when we have reached a stage where potentially a walker is not going to be used, it's not going to be used correctly, and it can increase fall risk, the next best option might be to just go ahead and have a wheelchair, allow your person to move as safely as possible around the home, and then for community, pretty consistently using the wheelchair. The other thing about like those transport wheelchairs is they tend to be really light. So if your person really wants to walk when you go out into the community, allowing them to push the wheelchair so they are getting that independence, that purpose, but also getting that extra support that they would get from a walker that they don't want to use.
That's a great tip. We've got one question that has come in. She said, I noticed that you use tactile cues. Do you have any verbal cues or phrases that can help motivate somebody to do ADLs? If they're refusing to do those ADLs, what strategies other than touch are helpful?
Yeah, so I really try to understand why this person is resisting doing the activity, because you'll typically find that the refusal is not just because the person's like, I just want to be dirty and never clean for the rest of my life. It's typically because there's something going on. So right now we have a woman who like would not brush her teeth, and we spoke to her and it turns out her gums really hurt. They're painful. So the toothbrush that she was using, the toothpaste that she was using, the mouthwash that she was using, like really burned the inside of her mouth. We also have another person who Amber and I both work with, who we talked to her about showering, and she was just like, I just don't know, like the shower head dribbles. I'm so cold because there's no shower curtain. And we went into her room, her bathroom, and we just pulled the shower curtain down, fixed the shower head for her, showed her like how to get it to the temperature, and did like a red arrow so she knows where to turn the knob to make it more comfortable. So I think as much as you can, dig and try to find out what the barrier is, or observe that person and try to find out what the barrier is. And then I really just think like, when you talk to someone and you're really clear about like, hey, I'm coming over here right now, I am going to help you take your shirt off because we're going to go take a shower, and acknowledging like, I know that this is uncomfortable. I know this is something typically, I think you said it's a daughter and father. So typically we don't see, daughters assisting fathers with something like that. And like, especially as women get older too, fathers assisting daughters with something like that. So that's probably really odd to him. So doing as much as you can to talk him through the process, expecting that that person may still resist those activities. But if we can find that balance of letting the person know what is going on, and then making the experience more acceptable from like a temperature, comfort, whatever perspective, you will see some improvements. And it may take time, but you will likely see some improvements.
Thanks, Danielle.
Thank you.
I have another question. I have often, we have a number of people who fall, and sometimes they're very serious. Sometimes they are just sort of, I slid from the bed, or I slid from the chair. Do you have recommendations about things that caregivers definitely should do in the event of a fall, should not do, or strategies for helping transfer people from the floor back up to a seated position?
Yeah, so I think that if someone is on the floor and you want to help them get back up, if it's going to hurt you and them, don't do it. If you don't feel like you can do it, don't do it. I mean, EMS and whatever first responder is coming has the training and the equipment to do it safely. So if you don't feel safe doing it, then don't do it. So if someone's fallen and their injury is really evident, like they have maybe a bruise coming up on their arm, or there's a cut because of wherever they fell, or they've hit their head and it doesn't seem like a serious injury, I think it's appropriate to help that person stand up. But if you think that there's any type of like spinal involvement, I would just allow that person to kind of stay in that position. I'm trying to think how I can show you, but I'll just try to describe it. And if it's too confusing, just tell me.
Really on the floor.
So when you are helping someone get up from the ground, so maybe they're laying on their back or they're laying on their side. You want to get them into that side lying position, and you can do that by bending the knee of whatever direction you want to roll in, and then helping them punch their arm across. So it's like this type of movement. And then they're on their side. And then you're going to help them push up into like a mermaid-ish position, almost to seated. But you also want them to tuck their legs as much as they can under them, because the goal is to get into like a kneeling position. And so then that kind of resembles a more like a position that like we can easily move around in. And then you can give them support. If you have a gait belt, put it on them at their waist, but that's a really good time to just like elbows under armpits and help them stand up, lean forward, and get into a standing position. If you have a wheelchair or a chair close by, you can also get into that kneeling position, and this I should actually be able to show you. You can get into this kneeling position and get the chair like right under their booty. You're helping under here, if they can, using their arms as much as they can, and it really is pretty, it's less work to be able to just get back into a seated position. Yeah.
Thanks, Danielle. Where do you get a gait belt, and does everybody need to have one on hand?
You can get a gait belt. I think Amazon is the best option because they just have so many varieties. The one that I have is like hospital grade and meant to be used with different people. So it's like this weird slippery plastic material. It's pretty terrible. There's fabric ones that you can use that you probably see, like if you have a home health therapist coming in using, those can be found on Amazon. I can share some links with Jenny or Ashley or Alice or Laura so that you guys can like see what I'm talking about. And I think, yes, it's helpful to have on hand if your person is moving around by themselves without any assistance, without any concerns, then you probably don't need one, but I think it's good to have on hand, especially if there's any concerns with balance. But again, you can just use a belt, a leather belt that won't, pop or snap on you.
Thanks, Danielle.
We had another question come up, and it was asking about if you have any tips for managing incontinence at night for men and for women. And so including like transfers, how to approach someone, how to work with someone, incontinence overnight.
Yeah, so that's one of those topics too, where that as an adult, we're not used to someone asking us, like, do you need to use the bathroom? Have you soiled yourself? It's embarrassing and it doesn't feel nice. So when I'm talking about incontinence with our residents, especially because when I'm talking to them about incontinence, I don't know them that well. I try to say stuff like, and this is what works for me, it may not work for everyone. I try to say stuff like, wow, sometimes it just hits me real hard and I'm rushing to the bathroom and I don't make it. Does that ever happen to you? So kind of like making them feel comfortable and not feeling silly for this happening to them or embarrassed in any way. Sometimes when I talk to people about wearing disposable underwear, I'll say, it can be helpful for me. Have you tried it? But I think that that's a really important time to realize that that's just a very personal thing for people and it can make them feel not good. And that's what we want to avoid. So I think finding, again, opportunities for them to feel normal and feel like nothing is changing. So even if that's just wearing underwear over disposable underwear, finding more attractive styles in disposable underwear, even getting that person on a really good toileting routine during the day where we are going to avoid episodes of incontinence. And then maybe just wearing those disposable underwear at night. So wearing regular underwear during the day, disposable underwear at night. So they are feeling, a little better about that situation. I think that the absorbent pads, or like they're also called chuck pads on the bed at night, can be really helpful because even if that person is maybe sleeping, they have an episode of incontinence, it's not going to get on their sheets. I also like to talk about it with some people by saying, I know that disposable underwear seems like a step back for you or something that's embarrassing, but what I want to avoid is you being put in a situation where you aren't able to make it to the bathroom or someone doesn't come quickly enough to assist you. And then, the group of people around you knows. This way it can be something that's private to you. You can share it with whoever you need to share it with. And then the additional benefit is that cleanup process is a lot quicker and you can do it more independently. So I think thinking about how you're framing it to that person. My goal is to make you as independent as possible. I don't want to make you feel uncomfortable by being a part of this. And so these are my solutions. What do you think?
That's excellent. Other additional questions, last minute thoughts, concerns? I think this has been very helpful and practical, Danielle and Amber. Thank you so much.
Thanks for having me. It was fun. Thank you, Amber.
Not a problem.
Thank you very much, Danielle.
Thank you. Nice to see you.
Thanks, Danielle.
Thank you.
Thanks for everyone for attending. I'm sorry there was a glitch with the link. For some reason, the link in the original email redirected somewhere else. So I'm glad those who are here were able to join us. And next month, Debbie Arnold in our Cognitive Empowerment program will be putting together a panel all about lifestyle changes and ways to just lifestyle tips and ways to slow the progression of mild cognitive impairment and dementia. So we look forward to seeing you. Danielle, Amber, thank you very much again for the demonstrations and for the incredible information.
Thank y'all so much.